examination. In this video, we will understand about the microscopic examination and the biochemical examination of CSF. In the microscopic examination, the normal WBC count in adults is less than 5 cells per microliter, and it is higher in neonates, where it ranges from 0 to 30 cells per microliter. Ideally, no RBCs or neutrophils should be present in normal CSF. Only a small amount of lymphocytes and monocytes can be present. Now, the total cell count can be counted using a manual counting chamber like Fuchs-Rosenthal type chamber or Newbar's chamber that is most commonly used, or by automated flow cytometry. In manual method, we will use a diluting fluid, that is Turk's fluid, same as that we use for WBC counting. The solution destroys the RBCs and stains the nuclei of WBCs. We take 0.2 ml of CSF, mix it with 0.2 ml of the Turk's fluid and charge the Newbar's chamber, and then we count the cells, and we can calculate that total cell count is number of cells we count in the 4 squares into 5. Now, after counting the total cell count, we need to know the differential cell count. So, we have to know the conditions in which there are increased neutrophils. The increased neutrophils are seen in bacterial meningitis, most importantly, cerebral abscess, subdural empyema. Increased lymphocytes are seen in viral meningitis, tubercular meningitis, and fungal meningitis. Not in bacterial meningitis. In bacterial meningitis, there was increase in neutrophils. Increase in CSF plasma cells is seen in Guillain-Barré syndrome, in multiple sclerosis, whereas increase in CSF eosinophils is seen in CNS reaction to a foreign material, fungal infection, parasitic infections. Now, there can be tumor cells present in the CSF. What do they indicate? They indicate the dissemination of the metastatic or primary brain cells, tumor cells, in the subarachnoid space, and they can be best detected by a cytological examination. Examples of tumor cells found in the CSF are leukemias, lymphomas, and medulloblastomas. It is most commonly seen in ALL. This is the picture showing the leukemic cells in the CSF. Now, going to the biochemical examination, we should know that normal glucose level in CSF is 60% compared to the serum level, and normal CSF glucose value is around 50 to 80 mg per deciliter. CSF glucose below 40 mg per deciliter is seen in conditions of meningitis, suppurative, tubercular, and fungal, and it is normal in viral meningitis. Increased CSF glucose has no significance. It just indicates tag. Total proteins are around 15 to 45 mg per deciliter. An elevated CSF protein can be seen in traumatic spinal puncture, in meningitis, in cases of drug toxicity, and mechanical obstruction, in cases where there is increased immunoglobulin synthesis, and collagen vascular diseases. Low CSF protein can be seen in patients with increased CSF turnover, like there is increased removal of CSF, in CSF leaks, in cases of hyperthyroidism. Also, we can check about the specific proteins in CSF. Which are these proteins? Like alpha-2 macroglobulin, beta-2 amyloid, tau proteins. This is seen in cases of Alzheimer's disease. C-reactive protein, seen in meningitis, myelin basic protein, and transferrin. So, myelin basic protein. What is myelin? Myelin is a component of the nerve sheath, and it is released during the demyelination, which occurs in neurological diseases like multiple sclerosis. So the level of myelin basic protein can be used as a disease marker during exacerbations. Ammonia level, it is directly proportional to the existing level of the hepatic encephalopathy, and we can also check tumor marker level in CSF. Now this is to differentiate between various varieties of meningitis. So meningitis, that is inflammation of meninges, can be of bacterial, viral, tubercular and fungal meningitis varieties. How we will differentiate? The parameters which will be used are appearance of the CSF, microscopic examination which includes neutrophils and lymphocytes, and protein and glucose level. Normally, the appearance of CSF, it is yellowish turbid in case of bacterial meningitis. In tubercular meningitis, it is also turbid, and it is so turbid that it forms fibrin coagulum on standing, which is known as cobweb appearance. In viral meningitis, it is clear, and in fungal meningitis, it is yellowish. Neutrophils are increased only in the case of bacterial meningitis, whereas viral, tubercular, and fungal meningitis show increase in level of lymphocytes. Protein and glucose level, they are markedly increased in case of bacterial meningitis and tubercular. They are slightly increased in case of fungal, and in viral they are almost normal, whereas glucose level are decreased in all varieties except for the viral meningitis. Now going to the microbiological examination. In microbiological examination, we should know the common agent responsible for the bacterial meningitis. The most common agents are group B streptococci, Neisseria meningitis, Streptococcus pneumoniae, H. influenza, and Listeria monocytogenes. The gram stain is the most accurate and rapid method. Culture-based methods can also be used, or PCR can be used. For viral meningitis, enterovirus are responsible for this. Reverse transcription PCR is the gold standard. For fungal, Cryptococcus is the most common examination organism. India ink can be used, and we can also detect the cryptococcal antigen. For tubercular meningitis, PCR gives the rapid and accurate diagnosis. Also, it's very important to know that CSF chloride levels are reduced in cases of tubercular